I'm Jim Guyette with Right at Home Realty, and I'm here with Dr. Alexander Matz. How are you?
Not too bad.
So, Dr. Alexander, what is it that you do exactly?
We here in Canada Vein Clinics in Lindsay, we treat varicose veins.
Okay.
That's one of the offices that we have, and people who suffer from varicose veins, from venous insufficiency, from different complications of the disease.
Okay.
This is the place to go to get treated.
So, are varicose veins, are they painful, or is it just something that you see, or what is it?
Well, it can be both, and usually it is both.
Mm-hmm.
Yeah, it's something which you can see, but they definitely become painful as well. With the time, it's a progressive disease.
Mm-hmm.
It depends on which stage you present. So it's not just cosmetic issue. They do bear some, health issues and possible complications, such as blood clots or developing leg ulcers and so on and so forth.
Okay. And what is your background?
Well, I'm a surgeon, so I used to operate on varicose veins like everybody else. We had a procedure which called stripping. The procedure started in the middle of 19th century and it never changed until today. So it's a little bit outdated, I would say. But from the beginning of 21st century, we had a revolution in treatment of varicose veins with way more, I would say, more effective procedures, which are minimally invasive. Mm-hmm. And my background is a minimal invasive surgery, so I truly believe in minimal invasive procedures because usually the results are way better, recovery is much faster, and the complications are way less. Mm-hmm. So therefore I started with minimal invasive procedures for varicose veins as well, about 15 years ago, and since then we developed way more techniques and methods how to treat it, and now we have minimal invasive procedures with very high success rate, mm-hmm. very close to 100%.
Oh, that's good. And your business that you're in, is it just, where do you have your offices in that, if people were looking to get this done?
Well, with our Canada Vein Clinics has about, for now, I think 13 clinics. Mm-hmm. And we spread around Ontario. We have several clinics in GTA. We have clinic here in Quarter Lakes. We have several clinics in Ottawa, as well as we have clinics out east in New Brunswick and Nova Scotia.
Oh, okay. And who would be doing the procedures?
Well,
are they all doctors?
Yes, absolutely. It's doctors. It's usually, we have surgeons. We have some other doctors who are specially trained to do that. It's you have to have special training in order to do those procedures. We do have ultrasound technicians who help with the procedures, with the diagnostics as well.
Mm-hmm. Mm-hmm. And is it a painful procedure?
Well, it's not painful. Usually, mm-hmm. it's office procedure with under local anesthetic. So,
okay.
Really, what's painful is just a little bit of anesthetic, which we administer, which you usually get. It's not more painful than let's say to go to the dentist.
Right. Oh, okay. And would men get this done also, this procedure?
Yeah, it's both genders. Women, they have a slightly more chance of developing varicose veins, but men get them too. The most important factor in developing is your genetics. If you had one parent with varicose veins, your chance of getting them 48%, if both parents, close to 100%.
Oh, okay. Okay. And I guess they would just give you the Canadian varicose vein a phone call, make an appointment, come on and see you? Yeah,
absolutely. They can call Canada Vein Clinics. They can go to the website, canadaveinclinics.ca. Yeah, and they can be scheduled in any place. If people have problems with varicose veins, that's how they usually find us.
Yeah. Well, no, that's awesome. Is there anything else that you'd like to add to this?
Well, that I think that you raised very important question about whether it's just cosmetic issue or it could bear some health hazards with it, and I think people should know that it is not just a cosmetic problem. It is something which they should take a look quite seriously, and as time goes by, we know more and more about the problem, and once everybody thought, oh, varicose veins, indeed, that's something which you can live with and you won't get much trouble from. But now we have more and more research showing that this is incorrect, that there is potentially quite significant complications that can be related to this disease.
Yeah, I guess general practitioners have been kind of brought up to speed on this, looking for some of the conditions that people are having related to varicose veins. And
yeah, that's true. We're trying to educate, but it's still not there yet. I think we should do more with that to get the family doctor, general practitioner know more about the condition, diagnostics, and all the treatments that we have now, state of the art new treatments.
Okay, well, thanks so much.
You're very welcome.